Good day, everyone, and welcome to Benita's Maternity Program webinar. Today, we are joined with Dominique LeClercq, who is a physiotherapist, and she's going to be giving us baby massaging and relaxation techniques to treat and help colic and windy babies. So welcome, Dominique, and thank you for joining us today.
Welcome, everybody. I'd like to give a quick overview of what we will be discussing today, so you can learn and know what to expect from this webinar. So we're going to look at why you should consider starting baby massage, what the benefits of baby massage are, different relaxation techniques, how to swaddle your baby step by step, what conditions baby massage can help with, understanding colic, constipation and wind, when you can start with baby massage, how to prepare yourself for baby massage, what types of oil to use, and also just a simple whole body routine to try at home. So why should I consider massaging my baby? Babies respond to the way we touch and handle them, so massage is a good way of getting to know your baby and gaining confidence in handling them. It should be an enjoyable experience for your baby and for you, so choose a time when your baby is content to be handled. So for example, between feeds and when your baby is not too sleepy. When you're more experienced, massage can be used when your baby is needing comfort and soothing. Massage will also help complement your baby's development. It helps maintain suppleness, flexibility, coordination, and relaxation. It also assists with promoting the functioning of the digestive system, circulation, and lastly with breathing. Lastly, it's a perfect way to start or commence communication with your baby, and this will also help with initial bonding with your newborn. There are a few benefits of baby massage that I'd like to discuss. So firstly, it encourages and improves sleep. This stimulates the release of serotonin. So this happy chemical promotes relaxation, which often leads to better sleep quality. It helps increase growth hormones and also reduces anxious behavior. And then it stimulates the gastrointestinal tract. So applying these massage techniques can really help reduce the discomfort of digestive conditions such as colic and constipation. If your baby is suffering from gastrointestinal issues, a regular massage will really help move things along, and this will reduce stress for both you and your baby. It provides a lot of pain relief, so especially for babies that are teething and with additional growing pains, a massage can really help reduce overall discomfort by releasing endorphins. Lastly, it also enhances development. So this is just by encouraging movement and assisting with coordination. There are a few relaxation techniques that you can try to calm or soothe your baby. You can use these techniques even when your baby is calm, because this just creates an overall positive experience. So start with talking or singing to your baby so that they are used to your voice. You can play classical music, white noise, room sounds, anything that is just very calm and is not such a high tempo. Creating a warm environment is very important, so to have a nice closed, quiet room that's not too cold. And then you can start with baby massage, which is what I'll get into a bit later. Swaddling, this is just a name of a technique where you wrap your baby in a towel or a blanket, but I will be showing you step by step how to swaddle your baby correctly. And then skin to skin contact. This is also very important that your baby can actually feel your skin. It just provides them a lot of comfort. So now I'm going to look at how to, or talk you through step by step, how to swaddle your baby. So step one, you're going to lay the swaddle. So when I say a swaddle, this can be a flexible blanket or a towel, whatever works best for you. So you're going to lay that in a diamond shape, and you're going to fold the top corner down to form a triangle. You're then going to place your baby in the center of that triangle, and the head will be just above the folded area. Ensure that the shoulders are just below the swaddle as well. It just makes it a bit easier for when you tuck them in. Then step two, you're going to place one of your baby's arms just slightly bent at the elbow and just tuck it in against the body. Then you're going to take the other side of the swaddle or the blanket and bring it across your baby's chest. Tuck the edge of the swaddle under the body just to ensure that it's a nice secure fit. So once you've wrapped it over, just tuck it a little bit under there. Step 3, you're then going to fold the swaddle up and over your baby's feet. So that's just to keep them nice and warm and nice and compact. And then finally, step 4, you're going to place the other arm against the body and bring the other side of the swaddle across and tuck it in. It might help just to tuck that excess fabric under your baby, and this will really ensure a nice, tight, secure fit. So what conditions can baby massage help with? So there are many conditions, but I'm just going to talk about the 3 most common gastrointestinal issues. So colic is our first one. We know colic to be is an uncontrolled, extended crying in an otherwise healthy and fed babies. So it's very common for all babies to cry, but if your baby is crying for more than 3 hours a day, 3 to 4 times a week, that is when we have said that they have colic. So colic is to believe to be caused by immature digestive tract. However, there's no pure underlying medical condition. Constipation, so that's just difficulty in emptying the bowels. This is just usually associated with the baby's feces just being a bit hardened. And then lastly, wind, that is just gas that is simply trapped in your baby's tummy. So your baby can swallow a lot of air along with her milk or his milk when they feed. So particularly if they're drinking from a bottle or if they are breastfeeding with a shallow latch. So just trying to understand colic a bit better. As I said earlier, it's not caused by a medical condition. Rather, it's just excessive crying, which can cause swelling of the air, which just leads to the trapping of that gas and discomfort. It's usually present between the ages of 0 to 4 months, and it should disappear after 4 months of age. So if you are looking for a few tips, the first one would be feeding tips. So this is just to help your baby swallow less air. So it might be best to sit your baby upright when they're eating, and then you can burp your baby during and after feeds just to help the movement of that air. You can also use sounds to soothe your baby. So as I mentioned earlier in the relaxation part, so classical music. You could also have the sound of a fan on in the background, or even the sound of a heartbeat. The track of that also soothes the baby, just reminds them of when they're in the womb again. And then lastly, just to calm your baby's senses, lay your baby on their back in a dark, quiet room. You can do the swaddle technique to wrap them up in the blanket. You can start with some baby massage, or even just to soak your baby in a nice warm bath. Next, just to understand constipation. So this really isn't a common condition. However, it can still happen. So usually when your baby starts eating solid foods, that's when you notice there might be a bit of difficulty. So if your baby seems constipated, there's a few things you can do with their diet. So you can change some of the solids that you've started giving them, but it's best just to consult a dietitian or your pediatrician if you notice that this is a common problem or it's happening a lot more. Another nice thing you can do is a constipation or abdominal massage. This can really help to ease those symptoms. It's always done in a clockwise direction when you're massaging the stomach, but a physio can help you and show you how to do it, and then from then on you can do it yourself. But it might be best to go to a physio so they can show you exactly how to do the massage. Next, understanding wind or gas. So that's just excessive gas that is caused by your air swallowing. This is normally during feeding rather than a problem with the milk. So it's just the way that they might be feeding, which can cause them to swallow some excess air. You can prevent most excess gas with effective burping. So effective burping is very important. If we want to look at how to do effective burping, don't try and burp your baby when they're feeding greedily. So rather try slow them down a bit, gently start patting their back just so they're used to the feeling as well. Then there are 3 basic positions. So gently pat and rub your baby's back. You can either do it over your shoulder with them sitting upright on your lap, or facing out or to the side. And lastly, Another nice way is they can be lying face down on your lap. So it might also be best to put a cushion with a towel, because sometimes with a bit of wind or gas that comes out, they might bring a little bit up as well. So when can I start baby massage? There is no age limit. You can start right after birth. Sometimes our preterm babies tend to thrive better with baby massage when you start the massaging in the neonatal ICU already. I'd really strongly recommend a physiotherapist first assist and demonstrate the exact technique if you are considering starting in the neonatal ICU. That's just to make sure you're confident and that you're also assured that you're doing it correctly. Try pick a suitable time in the day, both when you and your baby are relaxed. And sometimes it might be best just to wait 20 minutes after a feed or even after bath time. There are a few things to be aware of when you're preparing for baby massage. So just make sure the room is nice and warm, make sure you are relaxed and comfortable, that you have the time to sit down with your baby, and then also make sure your hands are warm. When we are looking at the types of oil you can use, I've just recommended oil that you can easily buy from a supermarket. There are other brands such as baby oil, but I strongly recommend grapeseed oil or olive oil, or if your baby has sensitive skin, coconut oil. The reason why I recommend these sort of store-bought oils is that if your baby does ingest some of it, then it is safe. Sometimes their hands might touch their body and go straight to the mouth, so then at least we know it is a safe oil for them to ingest. It's best to stick to the cold compress type. This is just because it's a pure form of distillation. And then check that your baby is also not allergic to that oil. So what I recommend is that you just test on a small area of the skin and leave on for 30 minutes and just see if there's a reaction or not before you start on the whole body. Warm your oil in your hands before placing it directly on your baby's skin, just to make sure that they are nice and relaxed. Your position is equally as important as the massaging technique. There are 4 different ways you can position yourself. So either on a cushion on the floor, most moms prefer this position, or you can lean back against the cushion. You can be kneeling down on a cushion or sitting between your feet. I find the last one, sitting between your feet, if you have sore knees, your knees will really get very sore there. So either position 1 or 2 tend to be the most comfortable positions. Now, how do I do this baby massage? So just ensure you have plenty of oils in your hand, and just make sure you also top this up during the massage so that it doesn't dry out. Try keep your hands in contact with your baby's skin as much as possible. This just promotes positive touch. And then the massage stroke should be in an outward direction from your baby's body. So out from the chest and down the arms and legs. This is actually the opposite to an adult massage. Flat hands are used on the chest, and then strokes up and down towards the shoulders. Circular movements in a clockwise direction. This is only for the stomach. And then single strokes down the back from the head to the buttocks. That also tends to be quite comfortable. And then lastly, just our gentle stretches. Do not force any of the joints or the stretches. A physio can help you to show which stretches are safe. I've worked out a simple whole body routine that you can practice at home with pictures, just so you know if you're on the right direction. So firstly, you can pick your position in which way you're choosing to sit, and then start with your baby on their back. Place your hands as flat as possible on their chest, and just start with single strokes up and down towards the shoulders and down the elbows. So we're just going to start by opening up the chest a bit. Then continue with the strokes down the arms, either together or separately. And you can just start with gentle wringing movements of the arms. So that wringing movements is if you're wanting to wring water, for example, out of a towel, but not that same pressure, so more very, very gentle and light pressure. And then for the tummy area, single strokes go from the chest downwards towards the stomach. As mentioned earlier, start with circular strokes in a clockwise direction, and then you can move down to the legs, so stroke down the legs, either one or both together, and just gently straighten them out. If you're wanting to look at the feet and the hands, gently just pull each finger open and spread out the toes. That also just encourages a positive touch. And then lastly, with some of the stretches before you move the baby onto the stomach, you can hold the baby's ankles, let their knees bend outwards, and gently push them back and forth towards the shoulders. This really helps with the winds or with constipation because it really activates then the gastrointestinal system. Now you're going to turn your baby onto their stomach, so you can roll your baby over. Start with single strokes down from the shoulders to the buttocks. You can use your flat hands. Then when you get to the buttocks, gently massage with the heel of your hand. And you can also start with some gentle stretches with bringing the foot up towards the buttocks, and you can do the same on both sides. So just a few extra tips. I just want to see you, just coming back, you can do the massage for as long as you would like. It all depends on how well your baby is tolerating the massage. So 20 minutes is a good time if you're looking for a guideline. So begin with just one part of the body. Move on when you become more skilled and more comfortable. Another good way is just to let your baby guide you. So start with gentle and slow touch when your baby is young, so they're also used to the feeling and the movement as they get older. And then just carry on for as long as your baby allows, and don't massage when your baby is obviously not happy to be touched. When we're talking about colic babies, for example, when you started your baby massage quite early after birth and they've agreed that it is a positive experience, then you can start if your baby's a bit uncomfortable. If you can see that they've got colic, you can start with the massage and see if it makes a difference. Talk and sing to your baby throughout the massage. That would just help relax them a bit more.
Thank you for joining our webinar.